Today we're going to talk about common skin diseases. The three common skin conditions that we see in primary care would be eczema, acne, and psoriasis. These are the three common conditions we see in our day-to-day clinic. First, we talk about eczema, which is a very common skin disease, and it is characterized clinically by extreme itchiness, dryness, and scaling. And it may present with acute onset, or it may be subacute, or it may become chronic, where patient may have it for months or years. And it can affect, but it's more common in children, and but it can also happen in adults too. As you can see from the picture here, this is an example of an eczema where you can see the skin is dry, there's some scaling, and patient may feel a lot of itchiness. There are many types of eczema actually. For the management of eczema, it is important that mainly we have to make sure the skin is um, properly moisturized. So a lot of time we use conservative method is to avoid the trigger, use a lot of emollient such as aqueous cream or emulsifying ointment to make sure the skin is properly moisturized. And sometimes we have to use other specific methods such as the topical steroids. We have to remember that on the face and scalp and in children, we try to avoid strong steroid, so we use hydrocort on this area because the skin on this area are thin. So if strong steroid may cause problem. And the moderate to potent topical steroids uh, would be, we will be using beclomethasone and mometasone and all that would be in other skin area other than that I have described above. And also use of topical steroids is limited to 2 weeks, and this the use of this will need physician approval to extend the use, because using more than 2 weeks may cause side effect like skin thinning and all the other problems. Another common skin condition is acne. In layman term, it's usually called pimple, and then it actually affect about 20% of the population, and usually it affect teenagers when they are in a lot of hormonal changes when they are at their puberty, and it may subside later when they are, the hormonal changes are more stable in their adulthood, and usually it will subside before the age of 40. The main factors that causing acne would be increase in the sebum production. As the teenager they undergoing hormonal changes, they have increased sebum production. This will make them more prone to getting acne. And also dark hyper proliferation, and also chronic infection of the duct with bacteria and chronic inflammation. All these will contribute to the formation of acne. The clinical features of acne include papules, macules, and also nodules or pustules when it's more severe. And sometimes they also have a lot of like seborrhea, which is greasiness, and then later on it may form scar, and also they may have post-inflammatory inflammation. This picture show an example of acne. As you can see, there are some papules and macules, and also some inflammation on the face. Management of acne should be targeted to the chronic inflammation as well as the effect on the psychological health of the patient. This is especially among teenagers. They will have a lot of psychological uh, issue, very severe acne. And so many management or treatment available for acne would be mainly a lot we use are the topical treatment with benzoyl peroxide, uh, retinoid, and also antibiotics. So, but sometimes we may have to use antibiotics and also oral isotretinoin. Oral isotretinoin is usually um, the third line of treatment because it is having toxicity uh, problems. It may have teratogenic effect and also hepatotoxicity, meaning affecting the liver. So usually it will only be prescribed by the certified dermatologist. And all this treatment actually it takes times to see the effect. So regardless of what treatment the patient have taken, an early effect may only be seen after 1 or 2 months of use. So that's why we may need to use the therapy for at least 3 to 6 months or more before we say that it is not effective and we need to go for other uh, options. Another common skin problem would be cysts. It affects 2 to 3% of the population, and it is usually characterized by heavy scaling and red silvery scales, which may or may not be itchy, and it can demonstrate Koebner phenomenon. But this phenomenon may also occur in other conditions like lichen planus, vitiligo, and viral warts. There are many types of psoriasis, which including chronic plaques, uh, palmar many affect the palm and the sole, and gutter psoriasis, and also other more severe form like erythrodermic psoriasis and generalized pustular psoriasis. These are more severe ones. And psoriasis can also involve the nails and the scalp. So when you examine patient with psoriasis or suspect psoriasis, it's always you have to remember to examine the nails and also the scalp. This photo show an example of psoriasis. You can see clearly there are a lot of psoriasis plaques with redness and scaling. The treatment of psoriasis depends on the severity of it. Of course, this would include the avoidance of potential triggers, drugs like beta blocker and lithium. Uh, and also, in addition, we may need to use topical therapy, which include like emollient, corticosteroid, Corta, and Tetrinol. And sometimes we may have to use ultraviolet therapy and immunosuppressive therapy for those that not responding. And for nail and joint psoriasis, we may need to use oral immunosuppressants such as like methotrexate, cyclosporine, and oral retinoid. And but this patient needs frequent monitoring for side effect. Okay, we are coming to the end of this part of lecture, and thank you for listening to this lecture, and don't forget to complete the learning activities.